Welcome to our show, Ask Your Doctor. I'm your host, Shivani Raj. For today's show, we have Dr. Damodhar Garu, who is an MD in internal medicine. On today's episode, we will be talking about lung cancer and some of its symptoms and what can you actually do about it and get more information on it with our doctor. So let us welcome Dr. Damodhar Garu onto our show. Welcome back, Andy. How are you doing, doctor?
Hi, Andy Shivari garu. Thank you for having me back. I'm doing good, Andy. So, good to be back. Yeah.
Last episode, we kind of did have a word about what exactly lung cancer was. You just gave us, an introduction about it. So, can we get in details about it? Firstly, can you explain what is lung cancer in just like a line, and also continue with what are some different kinds of lung cancers before we get into the symptoms and causes?
Sure. So, lung cancer is the most common cancer in the world now, and it's also most common cause of death in men, and as well as second most common cause of death in women only. And we discussed a little bit in the last, health show. So the causes, what causes lung cancer, and to summarize, 90% of the cancers are linked to smoking, Andy, and 10% of them are occupation related, which we discussed, asbestosis and other, you know, radiation, X-rays and stuff like that. So to go into further details of the lung cancer, basically the most common symptoms are, weight loss, cough, and coughing up blood, hemoptysis we call, and also the later on, they may get, breathless, shortness of breath. Okay, so the types of cancer, Shivani garu, it's like divided into two groups. One is squamous cell cancer and adeno cancer. And in the again squamous cell cancer, there is non-small cell lung cancer and small cell lung cancer. So usually, when lung cancer, symptoms start, bless you. So it's basically progressive onset, like progressive, like they may initially start having like symptoms of just feeling tired, like dry cough. Then eventually they may start losing, appetite and weight loss, unexplained weight loss. So they are not dieting, but they are losing weight, and then obviously they may start having symptoms like when the fluid accumulates, when the cancer starts growing, they may start having symptoms of shortness of breath, and they may start coughing blood also. The most important thing we have to advise general population, especially smokers, only. Smokers ki the most important thing is, I mean, like smoking is a tough habit we discussed last time, right? But the goal is to advise them to quit smoking, but again, to diagnose, in the beginning, like early diagnosis is the key. So for that, the United States Task Force (USTF) came up with some screening, methods. They have certain guidelines. Like people, smoking like ఎట్లా క్యాల్కులేట్ చేస్తారంటే శివన్ గారు ఒక సిగరెట్ ప్యాక్ తాగిన వాళ్ళకి యూనో పర్ డే తాగిళ్ళు అనుకోండి యూనో one pack per day per year తాగారనుకోండి. So it's called one pack per year. Okay. So if they smoke like 2 packs per day, it's called 2 pack per year. So if let's say somebody is smoking from age, let's say 20 years to 50 years, so they already smoked 30 pack years after that. So that means they smoke 30 pack. So the more years they have the pack years, now we calculate pack years, the higher risk of developing lung cancer. I probably have mentioned last time, in lifetime, let's say 100 మంది ఉన్నారనుకోండి, 100 మందిలో 30 మందికి they may end up with lung cancer if they smoke like 30 pack years. అంటే 30 years డైలీ ఒక ప్యాక్ తాగిన వాళ్ళకి 100 మందిలో 30 మంది they may end up with lung cancer. So it's very, very significant, cancer and very risky. సో ఇప్పుడు మన స్క్రీనింగ్ యునైటెడ్ స్టేట్స్ టాస్క్ ఫోర్స్ ఏమంటారంటే, యూనో whoever has స్మోక్డ్ 30 pack years, అంటే 30 సంవత్సరాలు ఒక ప్యాక్ పడే తాగిన వాళ్ళకి ఏజ్ 55 to 77, దిస్ అట్ ఏజ్, వాళ్ళకి ఎవ్రీ ఇయర్ లో డోస్ సిటీ స్కాన్ ఆఫ్ ద చెస్ట్ చేయాలండి. If they do that screening procedure, then they may detect the lung cancer in early stages. So when you detect the lung cancer in early stages, it's kind of pretty much curative. You can resect the, nodule or whatever, when, the staging, I'll come to the staging in the next, few minutes. In this also, ఇంకొకటి important point in a task force ఏమంటదంటే, suppose somebody smoked but they quit smoking, and వాళ్ళకి ఏమంటారంటే less than 15 years, అంటే 15 years ముందు స్మోకింగ్ వాళ్ళకి స్క్రీనింగ్ ఏమవసరం లేదు. less than 15 years క్విట్ స్మోకింగ్ వాళ్ళకి కూడా స్క్రీనింగ్ చేయమంటారు. లోడోస్ సిటీ స్కాన్ చేస్తే మనకు తెలిసిపోతుంది. సో అది వన్ ఇంపార్టెంట్ ఎడ్యుకేషన్ జనరల్ పబ్లిక్ కి, who smoked all their life and still they want to live longer. So just, get a screening CT chest. It's not that they need to continue to smoke, but they have to stop smoking. But at least, they can, get it over, like, and, like any other screening, like, mammogram, pap smear in women, for cervical cancer, we do all this, right? So it's very common all over the world now, So అది ఇంపార్టెంట్ అండి. తర్వాత నెక్స్ట్ థింగ్ ఏంటంటే, రేడియేషన్ ఎక్స్పోజర్ ఇస్ ఆల్సో ఇంపార్టెంట్. సో అన్నెసరీ సిటీస్, రేడియేషన్, ఎక్స్రేస్ అవి అవాయిడ్ చేయడమే బెటర్. ఓకే, సో దట్స్ ద థింగ్. నెక్స్ట్ థింగ్ ఈజ్ వీ గాట్ టు గో టు స్టేజింగ్. డయాగ్నోసిస్ ఆస్పెక్ట్, మోస్ట్ ఆఫ్ ద టైమ్ డయాగ్నోసిస్ ఈజ్ ఇనిషియల్లీ చెస్ట్ ఎక్స్రే అబ్నార్మల్ గా కనబడుతుంది. ఐ సెంట్ సమ్ స్లైడ్స్ ఆల్సో, ఐ థింక్ రసూల్ విల్ అప్లోడ్ దెమ్. సో చెస్ట్ ఎక్స్రే కెన్ బి అబ్నార్మల్, అండ్ వెన్ ద చెస్ట్ ఎక్స్రేలో ఏం చెప్పలేము. ఇప్పుడు న్యూమోనియా కూడా అట్లే ఉంటుంది, ఫ్లూయిడ్ కలెక్షన్ కూడా అట్లే ఉంటుంది. సో అందుకని టు డిఫరెన్షియేట్, కరెక్ట్ డయాగ్నోస్ చేయాలంటే సిటీ చెస్ట్ చేయాలండి. సిటీ చెస్ట్ చేస్తే, then of course the gold standard is you have to go to, you have to do biopsy also. There's so many ways you can biopsy now. Pulmonary medicine really, really advanced. They can do like, bronchoscopic needle biopsy, or, they can do CT guided needle biopsy. So they can they can even do endoscopy, like ultrasound guided kuda they can do it. So some difficult access in what. So there's so much development in the technology. So once the biopsy is done, then you know what type of cancer, right? So whether it is adeno cancer, or it is squamous, small cell or non-small cell. So staging kuda, we have staging also. The stage 1 is more, prognostically better. Stage 4 is, of course, spread all over. So metastatic, which is poor prognosis. So staging కూడా ఎలా ఇస్తారంటే, శివాని గారు, ట్యూమర్ సైజ్ ని, తర్వాత లింఫ్ నోడ్స్ ఉంటాయి కదా, లింఫ్ నోడ్స్ స్ప్రెడ్ అయిందా లేదా, తర్వాత మెటాస్టేటిస్. సో ఇట్స్ కాల్డ్ TNM స్టేజింగ్. సో ట్యూమర్, లింఫ్ నోడ్ అండ్ మెటాస్టేటిస్. సో దాన్ని బట్టి స్టేజింగ్ ఉంటుందండి.
I think my first question to you would be, let's go with the symptoms now that you've kind of explained about, the different kinds of, cancer, lung cancers that people can find out. Let's go with the symptoms, Andy. If they think that they are having lung cancers or any kind of cancers.
Yeah, most important thing is, people who are developing or cancer, they have kind of malaise, fatigue ఉంటుంది and appetite. They will lose their appetite. And unexplained weight loss ఉంటుంది. Unexplained, like you're not fasting, but so you can lose weight without reason. And also క్లినికల్ గా కొన్ని సైన్స్ కూడా ఉంటాయి అన్నట్టు. లైక్ ఇప్పుడు క్లబ్బింగ్ అంటారు. క్లబ్బింగ్ అంటే ఇప్పుడు నెయిల్స్ ఉన్నాయి కదండి, ఈ ఫింగర్స్, కొంతమందికి ఇట్లా క్లబ్బింగ్ వస్తుంది అన్నట్టు. కొంతమందికి ఇట్స్ కాల్డ్ యూనో అదేమంటారు, లింఫెడినోపతి ఉంటుంది. లైక్ సమ్ టైమ్స్ ద క్లావికల్ మీద కూడా యూ కెన్ నోటీస్ సమ్ స్వెల్లింగ్. అండ్ వన్ ఆఫ్ ద ఇంపార్టెంట్ థింగ్ ఈజ్ బ్లడ్ ఎప్పుడైతే కాఫ్ చేస్తారో దాన్ని హీమాప్టైసిస్ అంటాం కదా. సో యూ హ్యావ్ టు బి మోర్ cautious when you are coughing blood. It could be inflammation, infection, but it's better to rule out, especially young people coughing is most likely because of the infection, right? Or allergic bronchitis, something like that. But people who are in the middle age, usually the cancer kicks in after 40 plus years, right? So, and somebody who is smoking all his life and having those, symptoms, red flags, red flags. Okay, you're coughing up blood and you're losing weight and you're not feeling like eating and you don't feel like doing anything. So that's when you have to be worried, yeah. And I think the most important thing, like I said, is screening. There's like smoking. You still have a lot of people who smoke, and it's difficult to quit for them. But at least they should keep on trying, because people who quit smoking, the data is there that the lung cancer risk goes down. Plus, smoking వల్ల ఇంకోటి ఏంటంటే not just lung cancer కదండి, it affects everything. Like there's so many cancers you can lose, and bronchitis, and you may have heart attack, strokes. Like what is the benefit you are getting? You have to understand. Like like when people are young, they have when we were young, it was like a fashion. Like smokers, like, oh, okay, every movie you go, like there's all smoking there. Like, but in fact, I remember when I first went to Bangkok, they used to smoke in flights. The last seats were like smoker seats in the plane. Even when I went to London that time, they were still smoking in the last seats in the plane. So now there is no smoking, which is good, right? So I remember still the last seats were like smoker seats, in the plane. So there's so much, change is happening and happened also, and the ratio has gone down, and but still it's a very tough habit. So to get back to your question, so those are the symptoms, and sometimes non-specific symptoms can happen. People may not have any symptoms, but suddenly they go for some reason and they may end up diagnosed with cancer because incidental findings అంటారు. ఇప్పుడు మీరు వెళ్తారు వేరే రీజన్ కి, so they end up having a X-ray or a CAT scan for different reason, and then incidentally you may see a lung nodule. So lung nodule, like it's in the initial stages and it may not cause symptoms, but when they do the needle biopsy, then you may end up diagnosed with the cancer, which is a blessing in disguise. So I remember one nurse husband, he was not having symptoms, but he coughed up some stuff which is not looking, right. So she was a nurse and she was smart and she took it for testing, and he ended up diagnosed to have a cancer. So he was lucky, like his wife was smart, and she saved his life. Actually, he lived several years. So it can be sometimes atypical presentation too, and some people who are lucky, they may go for another reason and they may get diagnosed also. So that's one thing. And the worst cancer is. Like in terms of treatments, stage 4 is a bad one. Like, you have prognosis very poor. And usually non-small cell small cell and non-small cell differentiation law. Non-small cell cancer responds to surgical treatment, and small cell lung cancers needs chemotherapy only. That's a difference, one thing. And Mostly smokers will have small cell lung cancer. Like I said, evidence-based approach, is saying that low dose CT screening for eligible adults will actually save a lot of lives. You know, so that's one important thing.
Yeah, I think one of the common reasons, of course, is smoking. But I kind of also wanted to ask: is lung cancer hereditary, or any cancers are they hereditary? Like, let's say the parent had a specific type of cancer, or even lung cancer. Are there chances that it can go in, genetically to their kids?
Well, like I said, cancers, you know, um, sometimes you don't know, even like, people who don't smoke, who eat healthy, and who are really fit. The percentage is very little, but there is, idiopathic, we call idiopathic or familial. So there is always, if cancer runs in the family, then they have to go for genetic testing and issue in Europe. So I think there is some genetics testing they can do, and depending on the risk, they can do screening, more frequent screening procedures. But it runs in families. Yeah, most several types of cancers run in family, and if some people have like more than one family members, cancer at young age, I think they should go for genetic testing. But like I said, it's very small proportion. Like 90% is linked to smoking. So that's major chunk is related to smoking. And it's the most common cancer and most common cause of death in terms of, in men. And in women, actually, it's come to second leading cause of death.
Damodhar Garu, let's talk a little on the kind of treatments that are available in India and in USA. America, of course, is a developed country, but I think even India is now, getting a lot of new treatments, and the doctors here, the healthcare has changed drastically in the couple of, in the past 10 years. What do you think the treatments are, and how are the treatments happening here? And of course, there is still no cure to cancer, of course, and scientists are working day and night for it. But what do you think the treatment phases are here in India and in USA?
Well, yeah, there is a lot of advancement, in treating these cancers. I mean, like a lot of, rich people and celebrities, they come to America, like Sanjay Dutt, film actor, and even cricketer, famous cricketer, Yuvraj Singh, So he had diagnosis of lung cancer, and they came to America. Actually, Yuvraj Singh did great. Like he's even doing charity work now. After lung cancer, treatment. So I'm sure Sanjay Dutt is also doing good because he's still acting. So I mean, like the key is the diagnosis in the initial stages. I mean, you know. So there is surgical treatment, like if it is stage one and if it is not spread anywhere, you can remove it and follow it. And some people can do chemo radiation as a prophylactic so that it won't recur. But according to the type of cancer, it all depends. The prognosis depends on the type of cancer and stage of cancer. Like I said, the TNM stage. So, like like I was telling about the lung nodules, where incidental things are diagnosed. If the nodule is small, let's say 4 millimeter, like or less than 4 millimeters, and there is guidelines according to the American Thoracic Society. So if depending on the size of the nodule, may be sometimes benign and it's nothing, So you just have to periodically follow them with repeated CAT scans. So, but like I said, there is a lot of research. Immunotherapy has also come. Immunotherapy has really become, big thing. Like in, all over the world. Like especially Previously, some of the cancers, there was no hope, but when the immunotherapy came, the neck cancer, oral cancer, they are living quite a bit long. I know my friends, that they were actually at the verge of putting him to comfort care, like hospice. But when they heard about the immunotherapy, actually it gave 5 years extra life to, my friend's dad. I used to call him uncle, you know, and he lived extra 5 years. So, he would have died in like couple of months. So there is a lot of research and a lot of newer medications. So that's why it's important to educate people. I mean, like to get these screening tests, get it checked early. Unless you check it, well, you can't find it, right? Anything in life, like you know, unless you try or unless you check it, you're not gonna, find it, right? So that's why the earlier the better, and go for it. Like especially if you have suspicion, don't ignore it. My sincere advice is if you are worried or suspicious of something, go and get it checked. Don't delay it. I mean, like then you will regret. So that's the key. Like early intervention, and and there is so much facilities available. So make use of them. You know what I mean? So that's the key. So the sooner the better. So the prognosis depends on that. Like most of the time people, oh, okay, it's nothing. And especially our healthcare people are even worse. The doctors and nurses, they think, oh yeah, it's nothing. So then I mean, like unless you check it, it's hard to know, right? So it's better to to pursue it. So that's a sincere advice. And I can go into some of the other screening procedures also. Now that we are talking about screening, like there's so much screening happening for women, young people and old people. So for young people, like Pap smear is one of the very useful screening tests, because cervical cancer, you probably heard, used to be a kind of big issue in the past. Now now it can be diagnosed very early, early stages, and complete cure. So Pap smear and a Pap smear, young people, young reproductive age people should get Pap smear, and mammogram, of course, for breast cancer. Breast cancer mammograms. Different countries have different task force guidelines. So I'm sure your doctor will guide you. Early diagnosis is curable. Breast cancer is common in women. Then of course colon cancer is one of the horrible thing. Like people can just die within months if it is late diagnosis. So colonoscopy is another thing. Like it used to be 50 years, but now they even reduce it to 45, and even high risk people, even younger age. Like if somebody has cancer in the family, they even do it like 10 years earlier, colonoscopy screening. And if they diagnose early, it's curable. You just have to take it off, right? And then prostate cancer, of course, is a big thing now after Prince, like King, actually, King, United Kingdom King, he had like prostate cancer, right? So PSA, prostate specific antigen, it's a blood test you just do after 50 years. So and these are the main screening things, and of course lung cancer screening. So the key is like cancer can happen, like you said, even if you are eating healthy and not having bad habits, but there is a lot of information you learn and look and and live longer. So that's a key.
No, not really, Damodar Garu. I think you did have covered, all of it. But again, Is the cause for cancer? I think even that has not been discovered yet. What is the specific reason that cancer can come in body? So I think the science is getting advanced. Of course, what do you think as a doctor? How much advancement do you think is going? You will be expecting in probably 10 or 30 years, and as a doctor yourself, what is something that you want to say to the future doctors or people who are watching the show who are maybe interested in curing cancer or just becoming doctors and providing world-class healthcare? Anything that you want to say as a doctor to them?
I would love to actually. There is so much, advancement happened, and it is happening. Actually, if you look at the Nobel Prize winners and previously, so some of the cancers, my mom, I told you right when I was young, she had a blood cancer called leukemia. So that time there was nothing, but now most of the leukemias are curable, right? Even in later stages, also people are living longer, especially lymphomas and all. And this Gleevec and other new medications made a big difference. Immunotherapy has made a big difference. So every day, new things are coming, and hope is always there. But again, we don't know still so many other cancers. There's still cancers, still other diseases, still other viruses, bacteria, which we still don't know, right? So there is, it's a constant, like God, universe, it's amazing, like how the universe runs. Like we have tiny organisms, big organisms, like the body functions, goes on. So we don't know a lot of diseases still yet. And we don't know a lot of bacteria, viruses. So there is new viruses diagnosed, new bacteria diagnosis, new cancers. So it's a like ongoing process. To say when we're going to get everything known, I don't know. I don't think anybody can, anybody can predict or, who knows what's going to happen, eventually. So, but it's a big thing, like compared to like 25 years ago, and today. So let's hope, like, the
Yeah,
mankind, kind of keeps, you know, advancing, and
exactly.
one day we'll get all the answers.
I think COVID was definitely a big, example where, initially when everybody got COVID in their countries, we just thought it's the end of the world. We were just waiting for something to come help, but it did. So I think even in future, I think we should all pray and hope that there is a cure for all the diseases. But till then, we'll continue doing shows like these to educate people, of course. And I
Yeah.
think it's a wonderful
See,
initiative.
COVID, like you said, COVID is the best example because we didn't know there was COVID virus and it suddenly popped up and it changed the entire world. The entire world was just, kind of watching and listening all the time to COVID news. And, so yeah, man, I'm like, nature is strong, Andy. Nature is strong. So that's why we have to respect the nature. I mean, like,
That,
there is a saying, right? Yeah. Yeah.
that's completed. I think on that note, let us end this video. But again, on the next episode, we will discuss more with the new topics. Thank you so much,
Sure.
Dr. Garu, for tuning in. It is lovely, as usual, to have you on my show. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.